Your medical chart notes an allergy to penicillin, which is why we want to tell you more about it. Did you know that 9 out of 10 people who think they are allergic to penicillin can actually take penicillin safely? So let's talk about what a penicillin allergy is, explore whether it might be safe for you to remove your penicillin allergy label, and why you might want to do that. What is a penicillin allergy? Penicillins, including amoxicillin, are our best antibiotics and are used to treat many infections caused by bacteria in children and adults. Some people may develop a reaction to penicillins or other antibiotics closely related to penicillin. These reactions can range from a mild rash to rare life-threatening allergic reactions. But in reality, most reactions are mild side effects of the medication or of the infection itself and are not dangerous. They do not mean that someone is allergic to penicillin. So why do we care about removing incorrect penicillin allergy labels from medical records? In short, we want the best care for you. Penicillins are a first-line therapy for many common bacterial infections because they are the most effective. When a person is incorrectly labeled with a penicillin allergy, doctors need to use second-line antibiotics, which can be less effective, have more side effects, cost more, and also increase the risk of diseases that are resistant to antibiotics. While it is important to identify and label true allergies, it is equally important to ensure that people, especially children, who can safely take penicillin are not incorrectly labeled with a penicillin allergy. And if they are incorrectly labeled, this is where the process of removing a penicillin allergy, or delabeling, comes in. The current recommendations suggest that your healthcare team can check your reported symptoms against current evidence and then make a decision about removing your penicillin allergy. But we understand this process makes many patients and caregivers anxious, and additional reassurance is needed. The gold standard test for penicillin allergies is a penicillin or amoxicillin challenge. Essentially, this means giving a small dose of the antibiotic in a supervised setting to see if an allergic reaction occurs. Being in a hospital is the safest place to do this challenge, and only patients who are at the lowest risk for a reaction are tested. First, your healthcare team will determine if you are in the low-risk category, meaning you have had a mild reaction that did not require medical treatment, mild symptoms including skin rash that appeared more than an hour after taking the medication, a headache, diarrhea, vomiting, or abdominal pain as the only symptoms, or a reported family history of a penicillin allergy. If this type of history applies, then you are considered an excellent candidate for the penicillin challenge. The challenge involves receiving 1 dose of a penicillin, either in an oral form called amoxicillin or an IV form called ampicillin. Prior to the challenge, your healthcare team ensures that all the necessary precautions are in place, just in case you have a reaction to the medication. After taking the dose, you will be observed for the next 30 to 60 minutes. If you show signs or symptoms of an allergic reaction, you will immediately be assessed and, if necessary, treated with medications to address this. If there is no reaction, it means you have successfully passed the penicillin challenge. The healthcare team will then take the necessary steps to remove the penicillin allergy label from your medical chart. We will also provide you with a document that you can take to your family doctor and pharmacy so that they can update their records with this information. If you still have questions about penicillin allergies and the process of delabeling, please ask your healthcare team. Our goal is to provide the best care, and that means being able to prescribe the best antibiotic medications.